My name is Tim Long. I'm the CEO and founder of New Life Medical Centers, and today I'm going to talk to you about Semaglutide. This is for educational purposes only. This is not medical advice. Please seek the advice of a medical professional. Even if you come into our clinic, you've got to talk to the provider. Well, first of all, Semaglutide, you already know about it. It's everywhere. It's on the news, all social media. All the celebrities are losing weight with it. It works. It's effective. And it's so popular, they're running out of it continually. But let me tell you what to kind of look for and how to actually save a little bit of money. First of all, the Semaglutide, as you know, it controls the appetite, or it actually helps to control the appetite and to control the cravings. It also slows down your digestion so you can absorb more food or nutrients from the food. In the studies, it shows that 14.9%, well, most of the patients lost an average of 14.9% of their body weight. But what we're seeing anecdotally here in the clinic is more than that. Pretty substantially more. And that's without any exercise whatsoever. It's only just starting to take Semaglutide. So we definitely believe in it. It's the best weight loss drug we've seen since we've been in practice for 10 years. It's great. Now, every medication has some sort of side effect usually, or can have side effects. 60% of the patients who take the medication have zero side effects, none, which is awesome. 40% have some sort of side effect. And it's usually ranges everything from headaches to nausea, diarrhea, constipation. But what we hear mostly is nausea and little small headaches. Now, even with the nausea, it ranges depending on, it just depends on the person. Sometimes they will take them, when they first start taking the medication, they'll get a little bit of nausea for a week or two, then it kind of goes away. Some patients, they'll get nauseated when they take the shot. It's just when they'll eat, they get a little bit of nausea, and even eventually that even goes away. So if you can deal with the side effects, even if you're at 40% that you have the side effects, you can deal with it, get past those first few weeks, it works great. So it's an awesome medication. Again, it helps you to be able to control your appetite, control your calorie intake, and make better choices. It works great, and actually works better than what most people, like I said, see in studies. Now, what's going on in the marketplace? How can you get it the cheapest? Well, what is most commonly done in the marketplace when you talk to other clinics and even physicians is you come in weekly and you pay weekly for an injection. We don't do it that way, and I'll explain why. The way we do it is, well, let me explain what Semaglutide is. First of all, it is a compounded medication, which means it is not made by the big pharmaceutical companies like Merck or Pfizer or one of those. It's made by local pharmacies. And when a compounded medication like that is a patient-specific medication, which means it's for you only, in your name only. So legally, the proper way to do it is to order the medication in your name. The pharmacy makes it, ships it to your home, and you can give yourself the injections at home. And that's the proper way to do it. Now, also, you can actually, like with our patients, you can bring your medication, it's shipped to your home. You can bring your medication to us, and we will store it in cold storage, and we will pull out your medication weekly, pull out your injection out of your vial, and give you your injection from your medication, then we put it back in storage. That's a proper way to do it. But that's not what happens most of the time. Most of the time, what happens is clinics, they will give you an injection out of someone else's prescription, because it's patient specific. And if you don't get a prescription for it, they must be getting the medication from someone's prescription. So you just have to be leery of that, because if there's ever an issue arises at the pharmacy and they have to track that medication back down to the patient, because each medication has a lot number, if you have your own medication, they can track it down quickly and easily and deal with the problem. But if you're getting a medication or injection out of someone else's medication and they can't track that lot number to you, you may experience the side effect of whatever issue is happening, but they can't find you. So that's why it's dangerous. So you want to make sure that whatever clinic you're going to, that you get your prescription, it's shipped to your home, and you get your injection out of your medication. So why do clinics give patients injection out of other people's prescriptions? It's all about the money. For example, if you get your own prescription, your cost per injection is about $15. So if you go to one of these clinics that are charging $50 up to $95 a week, pretty common is around $75, $50 to $95 in this area. and their cost is only $15, they're making a difference. So that's why clinics are willing to take that chance. So that doesn't mean that if they're charging you weekly that you're not getting your prescription. You just need to make sure that when you go into the clinic and get your injection, that you see your vial, because it'll be your name on that vial, that they get that injection out of your vial and give you the shot and then put it back in storage. So just be aware and make sure that wherever you go, that you get your own prescription, because legally that's the only way they can prescribe it. So, and again, if you get your own prescription, you're going to end up paying about $50 per injection versus $50 to $75. So that's kind of what to look out for. That's what to be aware of when you're talking to clinics. Just make sure that you're getting your injection. And the way we do it here is we write your prescription, it's shipped to your home. You can give yourself an injection at home, or you can break it to us, we'll give the injection to you and we'll store it for you. But again, your injection is always coming out of your vial. It also saves you money. You're only paying about $15, especially in the beginning. And you're safe, it's cheaper, and it's the best way to go. So if you're looking to take semaglutide, we're more than happy to answer any questions that you have. Just give us a call at 901-213-0100, or click on our website, schedule an appointment, and we'll be glad to serve you in any way that we can.